Some new details about the conditions inside a pair of Ontario nursing homes when the military was deployed to help out last year. Reports from the military obtained by CTV News say dozens of residents who died at the two homes in Toronto perished not from the virus, but because they were neglected and dehydrated. Reports say there wasn't enough staff to care for the elderly residents. The reports cite failures at the Downsview long-term care home and the Hawthorne Place Care Centre. The reports were included in the Independent Commission's report that slammed the Ford government in Ontario for being slow in its response to the pandemic. Laura Tamblin-Watts is my guest, CEO of CanAge, Canada's national seniors advocacy organization. She's joining us today from Sandy Cove, Nova Scotia. Always good to see you, Laura. Thanks for taking some time for us again.
Thank you.
These documents, very disturbing, deplorable as well in terms of the conditions of the long-term care homes. What are you taking away from them?
This goes to show again what we have known before. Our long-term care system has been in distress before COVID-19, and the government's response has been extremely slow. We saw in the reports that there was 12 days between when Minister Fullerton commented that we needed very quick action and when Premier Ford actually reached out, and we know that those 12 days caused not just COVID-19 deaths, but deaths from neglect.
And that's the part that's the most shocking here. We just want to reinforce what we're talking about. So dozens of people dying of dehydration, not because of COVID, but rather dehydration. What does that mean?
They were literally dying because they had lack of water, lack of food in some cases, and in other cases, a quick wipe down would have helped because they were sitting sometimes in feces and unclean conditions. So imagine you are literally leaving somebody completely alone and they're dying of thirst. There is absolutely no conscionable way that we can accept that these types of conditions are happening right here in Ontario.
Absolutely. And in Canada, a rich G7 country with a healthcare system that's supposed to be the envy of the world, and we see these kind of situations happening here. Were you surprised to see what was in those reports?
I'd like to say I was surprised. What I can say is I was shocked, perhaps, but not surprised, because at CanAge and other organizations were calling into the wind and saying there is just no staff to take care of people. Before COVID-19, we were incredibly short-staffed. The staffing collapse was completely predictable, and the long-term care homes associations were telling the government that we are in desperate need. And yet we see that people can only run so quickly. But to have people die of thirst, of neglect, of lack of food is really shocking to anyone with an ounce of humanity in them.
How would you characterize the way the Ford government has tried to defend its record in Ontario?
It's unconscionable. We have seen time after time, whether it's the Auditor General's report, whether it's the Long-Term Care Commission's report, or any of the other investigatory reports that we have had over the past year, that this government is deflecting and blaming previous governments for things that actually were happening during their tenure during COVID-19. Yes, long-term care has been in disarray for a long time, but this government's refusal to prioritize long-term care and waiting for responses for things like getting staff in to prevent people from starving or being dehydrated is a failure of government at the most profound level.
Has it also highlighted, Lauren, the condition in some of these homes? We'd like to think that this will, quote, never happen again. What sort of action are you hearing about, are you seeing?
Not a lot of action. We're seeing very slow steps. We have finally, after a year of begging for some substantive investments in things like PSW training, we're starting to get some. But again, that's a long time before we get those people in homes. We know we've got promises of 4 hours of work care in 4 years. We don't need it in 4 years. We need it now. And we're seeing some promises of investments around national standards, but Ontario has been slow to say whether or not they would participate into national standards. So this is an area where we have seen a lot of words and not a lot of action.
Lauren, I really appreciate you taking the time, as always, to come on the program and share your thoughts on this. Thank you.
Thank you.
Laura Tamblin-Watts.